So how's it going, guys? So we got a VIP patient over here, right? So I understand you've been having hyperhidrosis, which is sweating in the hands, right? Mm-hmm. So break it all down. What's been going on with that?
I have sweaty palms, sweaty feet, sweaty armpits, constantly. Mm-hmm. So I've just been dealing with that my whole life.
Okay. How long have you been doing it? So basically what, like 10, 15, 20 years plus?
Yes.
And what kind of things have you tried to control it?
I tried Botox in my armpit and Miradry, and neither worked.
Anything you tried for the hands or the feet?
No, nothing for my hands and feet. I just kind of dealt with it.
Okay. For hyperhidrosis, right, it does make a difference in terms of what area of the hands we're dealing with. So when I feel it, right, this is very sweaty over here, sweaty over here. It's becoming less sweaty here. Are we in agreement? Right? Mm-hmm. Same thing with the thumb. Right? So this region over here, this is the eighth cervical dermatome over here. So that gives an idea. So okay, possibly first dorsal, the upper dorsal area of the spine. And then over here, this is the first dorsal nerve, right in the webbing, right here. So we feel this. This is actually the most wettest part among all the areas I test. 8th, 7th, and they're going to 6th. Nope. Here. The first dorsal nerve. This is the most sweatiest part. So now we're going to isolate more. Okay, so we're talking about a little bit lower in our spine. So you're the first dorsal, but now I'm more closer to attention to the second dorsal, either going to be second dorsal vertebrae or possibly a combination a little lower as well. Right? We're going to check the right one. Same story as with this one as well. It is sweaty over here and start diminishing, and then this is like a bog. It's like a swamp in here. So there's a lot of sweat in here as well. So which one is the most sweatiest in terms of the upper part? Are we talking about the hands the most? What about the elbows?
The hands the most.
Hands the most. So what's secondary? We're doing
my armpit.
The armpits. Does this ever get sweaty?
Not really.
Not really. Okay. So the reason I'm asking all these questions is because it gives me an idea of, okay, how severe is this hyperhidrosis for the upper part of her back, all right? Now let's take a look what's going on for the feet as well. Now, for the lower part, what I want to know is, which one's worse, your foot, back of your knee, or elsewhere?
My feet.
The feet. What about the back of the knees?
Yeah, they still get really sweaty.
Okay, so the feet's the worst, right? Let's check once again. Which one's most sweatiest you feel? On this section or this section? Inside your foot or the outside?
I kind of think the outside, or kind of like the middle. I don't know, I never touched them.
Don't blame me. Not too well till you touched it, right? But actually, it's this region over here. So this is more closer to like the 5th lumbar nerve dermatome. See, it starts to dry out. Nope, I'm sorry, it's not corrected. So way out here, this is actually the most sweatiest part. So I'm going to show the other views over here. Let's double check on the left one. Yeah, see, this is the most sweatiest part right over here. So usually this is over here, this is the 5th lumbar nerve over here, 1st sacral nerve over here, and 2nd sacral nerve. So right over here, this is the wettest part I felt so far. And I'll also notice on the foot, same story as well. So the 5th lumbar nerve, okay, dermatome area, this is sweaty over here. Okay, let's go back to here, make it easy for the viewers. So this is actually the most sweatiest part. I'm sorry, second most sweatiest part. So this is the 5th lumbar dermatome area. And over here, this is the most sweatiest hormone. This is the 2nd sacral dermatome, the nerve over here. So along the spine itself, I'm gonna take a look. I'm gonna pay attention. I'm gonna confirm it on her during examination. Are we actually confirming our hunch? So is that really gonna be that 2nd sacral nerve issue, or a combination of the 5th lumbar nerve, which is 5th lumbar nerve itself? But most likely, already my hunch is leaning towards that 2nd sacral segment itself. That's the one I really want to confirm on you. Double check and see if we can help you with that matter. Okay. the reason why we're following along the S curve over here is because this patient has scoliosis over here. We're following along the route for spine itself. Yeah. There. Tender right here?
A little bit.
Because it's swollen right here. What about this fella right here?
A little bit.
But not as much as this.
Yeah.
Because that's what I see over here. See, there's a huge swelling over here.
What does that mean?
That means something's out. So when a structure gets knocked out of alignment, your body tries to protect it. And that's how inflammation starts. Here's the story. Since you're a pharmaceutical rep, you're also familiar with the biology, right? So when the intracellular material start leaking out into extracellular area, right? So since there's a positive and negative charge, it starts interacting. And that's how inflammation starts. So one of the byproducts of inflammation is your body starts swelling up. It's trying to stabilize and protect this area, and at the same time trying to introduce white blood cells into the area to deal with whatever's going on in here, right? So that's what that swelling is all about. Now when we test for these fella, the tender right here?
A little bit, yeah.
Yeah. Yeah, see, it's like a speed bump right over here. See, you don't have that on the right side, but on the left side, it's definitely there. So this second sacral segment, that's in trouble. Let's check. Yeah, that's moving decently. Yeah, that's moving too. So it's that second sacral segment. Let's see what else is going on here. Got some swelling right here. How's that fella right there? It's no walk in the park. All swollen on the right hand side over here. Got a part of it that already went. It tells us, no, we're right on the money. This fella's itching to go. Which one's worse? This bottom part here or the top part?
The bottom.
Yeah, this thing's more stuck. Okay, this is another one we gotta address. So we tested, confirmed. This is what I found over here. It's this sacrum over here. Originally, it's in 5 pieces. And because we gotta come out of mommy somehow, right? It's not fun if you come out as, full grown, skeletal, it's just not fun. But here's the thing. This is actually the last bone to fuse in the human body. Roughly around 27 to 32 years old, it should merge into one bone, unless you had some kind of trauma that knocked it out. And we do see a very enlarged sacral rudimentary disc over here. This thing is too swollen and too big, and we also confirm signs of it, that you had that swelling on the back of you. So this is the one we need to address, right? Now, another matter is in terms of, okay, what's going on with the hands, right? So we did touch base on that because it was very sweaty right here. I do see that this disc over here, it is enlarged and sweaty over there. I'm sorry, swollen. So this is enlarged and it's swollen. A little tongue twister, right? It's like sweaty and swollen. Yeah, a little tongue twister there. Right? But no, this is swollen over here. So it's the second dorsal over here, and we tested an L on you. That one we do need to correct as well. And also, backtracking a bit, that second sacral nerve, and that's also what we confirmed on you as well, the outside of your feet. Yeah. So I'm not guaranteeing all these things will address it, but this is a matter, let's correct it, and then let's see what the outcomes are. Another thing I also see on the film is this. This is your stomach, all right? Now for a normal patient, what's supposed to be normal is this. You're supposed to see a small little gas over here. That's what's typical. But we see not only the whole entire thing is enlarged, but we also see over here, we have a gate over here, a sphincter. It's blown wide open, and we see all this gas is just dumping straight into your small intestines, right? And then goes straight into your large intestines as well, because the large intestines, all we have here is constipation, right? And when we take a lateral, the same story is here as well. Right? It really, again, should be like that small little space over there. But instead, it's this big, that's how big the stomach is. And we have the sphincter wide open, it just dumps all the contents right into all over here. So your whole entire small intestine is over here. It's all filled up with gas, it's all bloated in there, right? So that's what we confirmed and double checked on you. It's that 6th dorsal over here. So we confirm it once more again. The second sacral nerve over here, that nerve travels right down to the outside part of your feet, right? All the way from there, straight out to over there. So once again, we're going to correct that. Now, because this is a foundation, it can affect that 5th lumbar. Now on you, it's actually hypermobile. We actually tested on you, that 5th lumbar, there's no problem with it. Now, one of the signs and indications that there has to be an abnormal temperature reading at that particular level. There wasn't any. It has to be stuck and not moving at all, but it is. Okay, so that's not a reading out, that's not an indicator either. I didn't find any swelling in that area either, right? So even though, yes, we did test on your foot, it is sweaty on that 5th lumbar dermatome area. However, the way I believe is this, because this is unstable, right? Like the foundation itself, it's causing your whole entire body to rock a lot more, resulting in that 5th lumbar to move even more itself, just like this over here. If this 5th lumbar is moving too much, okay, it's going to impact what's going on. I'm sorry, if the sacrum itself is unstable, it's going to cause the top part to move a lot more and maybe irritate that nerve. So it may help explain why you're feeling that 5th lumbar, the inside of your arch gets very sweaty. So we're going to correct that one, and then we're going to get some feedback, right? Because again, I'm not guaranteeing this is exactly going to be the problem. So that's why we're going to test it. Why? Because every person's nerves are different, right? It's not exactly wired 100% the same. While here, the major trunks of the spinal nerves, yes, they are the same, but once we start branching out, it may cause some differences, right? Now, other component is the fact that we also have different areas of the nerve system, right? That's what we call parasympathetic and sympathetic. Plain English language is that sympathetic is like a gas pedal on a car. When you press on it, it makes things move. Parasympathetic is like a brake. It's supposed to slow things down. Right now on you, okay, this nerve region over here, okay, that's where things start to blend, right? This region over here is the sympathetics. Everything else is parasympathetic, it's a brake pedal. So it starts to mesh and blend right over here. But somehow, it's not getting that signal properly, and it keeps on telling the body, okay, boom, 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 let's start releasing more sweat, more sweat, more sweat, when it shouldn't be doing that. So we're going to clear that irritation, take that pressure off that nerve, reestablish the communication, and it says, hey, well, wait a second, we don't need to release all these sweats anymore from sweat glands, right? So we got that component. Other thing what I found on the upper part of your back, okay, is the 2nd dorsal nerve. This nerve over here, okay, and that's part of it, but also provides structural support for this lower part of the neck. This lower part of the neck, that's where it starts going to what we felt over here. This region over here, that's where we start to feel very sweaty on the outside over here of your head. And that's sweaty right to bam, right there in that webbing itself. Right? So we're going to adjust that. Now, the midpoint of the spine, the 6th dorsal, actually goes to what we talked about here. This sphincter over here, another way, is a floodgate or a gate. This one is what most people are common with. If this is wide open, all your contents, the acid, stomach acid, start to go back upwards, up the throat itself, and that's what we call heartburn, right? Everyone knows what heartburn is. Now, on you, and that's what we found on X-ray, this is working just fine. So we don't have this problem with this gate over here. We do have a problem here, on this bottom part of this floodgate. This sphincter should be closed, right? So there shouldn't be any gases. So when we have gases, and that's the normal component of it, we're supposed to break down and have byproducts because the bacteria and the fungus, that's all that probiotics and everything else, good guys, breaks down our foods, and the byproduct will be gas, right? Now, all that gas keeps on going upwards and goes straight into the stomach here. That's why we see that stomach itself, it just swells up like a balloon. It just gets really huge. This gate is supposed to block it and prevent the gas from going into your stomach. It's not doing its job. So once again, we're going to correct this, and I want some feedback on the following visit, because it may or may not be immediate. Some patients, they report that, hey, wait a second, yeah, I do feel a little less bloating, but the more immediate, the more, more noticeable difference is going to be the next 24 to 48 hours, or even 3 days. But most patients, they report within the second and third day, says, yeah, there's going to be a difference there. So that's the thing. You got to give us some feedback on the following visit, what it's all about, right?
Mm-hmm.
Okay. Now here's the little trick with this case on here. Because she's petite and flexible, I'm not going to do my usual knee test or high-low. And also with the scoliosis over here, I want to see what it does biomechanically. So we're going to do a push maneuver to correct this fellow over here. And then I'm going to address that 6th dorsal and then the 2nd dorsal itself. And especially with that side slip over here. And another component I also want to show you, you did mention during the consultation that you felt like the right scapula started moving backwards like this. So the reason why it's doing that is because it's all the way down here. When your foundation itself starts to do like this, right, twist quite a bit, your upper body, okay, it's going like this. We can't walk this way. You ever seen anyone walk this way? No way, right? Our head has to go follow along the route, right? So what your body had to do was no choice but to compensate, start twisting. And that's when we see the right shoulder is going backwards. And then your head, everything else starts going like this way. So now we could actually, even though you may feel you may not be feeling twisted because you're so used to that position, but your head is straight on, whilst the rest of your body is twisted like this. So how do we get you from this right shoulder backward this way? We have to address the foundation, try to take out as much of the twist as possible, right? And then your body is going to start coming back a little more center alignment. Are we going to make this thing straight as a rod? No, we can't. The reason why is because your body adapted to this position for so long, and especially since you're already past that critical age. I believe you're 25 years old right now, 26. Right? 26. So that's what I'm saying. Your body already has adapted. There's already muscle patterns and also structural and bone patterns. To make this thing straight, no, not going to happen. So our primary purpose for today's visit is we're going to restore the nerve function, help you with that hyperhidrosis. That's what that swelling is, right? And also let's deal with this Megan blast syndrome as well. That was it.
That was it?
That was it.
That was easy.
Just relax a little more. There you go. Just relax.
I don't know, I guess I'll notice in the next couple hours. I guess I feel a little less tense. Mm-hmm. A little more free to move my shoulders and stuff around.
Okay. What does it feel like to you? Do you feel less sweaty?
I do feel a little less sweaty.
How much would you say?
I don't know, they're still clammy, but
I understand it's clammy.
I guess a little less wet over here.
Mm-hmm. Because that's what I feel. It doesn't feel as, this doesn't feel swampy as much. Yes, you do have, sweaty palms, but it's not as bad. Yeah. All right, so I want some feedback. You let me know how that one felt is, okay? All right. So this is still sweaty here, okay, both of them, which sometimes I'm not too surprised about because you do have swelling at your back. So your homework is this, because we got to get that pressure off that nerve. I want you to ice your low back 20 minutes 3 times a day, but make sure you wrap it with a cloth because you're skinny and petite, right? You can get frostbite, so that's why you got to cover it. Make sure there's a cloth, okay? Don't put skin, the ice pack directly on your skin directly. That's what I'm saying. The risk of frostburn is definitely there, okay? Especially for petite ladies such as yourself, right? So do that 20 minutes 3 times a day for the next couple of days. Actually, in your case, probably a week, All right, get that swelling off of that, and give us feedback on the following visit. Let us know how the feet's doing, and then also the hands itself. Okay, armpits, the knees, and also how's the bloating is. All right.
Okay.
Okay, we're all set.
All right. Woo!
Fill us in. How's everything coming along?
My feet aren't as sweaty.
Mm-hmm.
My hands are a little sweaty right now, but they're not like a puddle anymore.
Right, let's show to the viewers over here. Okay. Okay, so it's just very, very slight.
Yeah.
Very, very tiny dampness over here, but this is dry. This is also dry.
I think the more you touch it, the sweatier they get.
Yeah, but right now it's dry. Hey, this is nice. Just slight sweatiness over here on the pinkies.
Mm-hmm.
Yeah, that's good progress. How's the bloating and all that stuff?
That's good. Mm-hmm. Not bloated that much anymore,
Mm-hmm.
but we'll have to wait and see.
Okay, how much would you say is still left in there?
I don't know. I have no idea. I noticed with certain foods I couldn't eat because I get bloated, so I still kind of watch with that, but I guess I'm just not as bloated lately.
So even with those trigger foods, it doesn't bloat you up as much?
I haven't really eaten them, but I think it's going good. I think I'm less bloated.
Hey, that's great. We'll take it from there.